Have you ever worked with a stroke patient who could move their arm but struggles to hold a cup? Or a patient who can stand but struggles to step forward? That's exactly where the Motor Relearning Programme, MRP, comes in. Welcome to Physioclassroom. In this video, we'll introduce you to the Carr and Shepherd Motor Relearning Programme. MRP was developed by Janet Carr and Roberta Shepherd in the 1980s. They both were Australian physiotherapists. MRP is based on principles of motor learning, motor control, and neuroplasticity. They realized that patients weren't improving just by lying in bed doing passive movements. They needed to practice real-life tasks, like walking, standing up, or using cutlery, in a way that encouraged the correct movement patterns. Unlike traditional neuro approaches that focus mostly on muscle tone or reflexes, MRP focuses on teaching the brain how to control purposeful movement again. Here are the core principles of the MRP approach. First is task-specific training. Practice the task you want to improve, walking, not leg raises. Second, analysis of movement. Observe and study the movement and identify which part of the movement is missing or abnormal. Like this patient has circumductory gait, so we see that hip abductors and ankle dorsiflexors are the missing component of the gait, due to which patient swings the leg and hikes to clear the foot. So we are identifying the missing components here. Next is practicing the missing components. Train weak or poorly controlled movements separately in your rehab. Like here, we designed a simple exercise to retrain the hip flexors and dorsiflexors to facilitate the movement. Next is practice the whole task. Reintegrate the components into the full activity. So choose a purposeful daily activity like walking and practice integrating the learning there. And also encourage use of the affected side. Avoid compensations like overusing the strong side. And lastly, feedback is the key. Visual, verbal, and sensory feedback helps shape better movement. So the goal of MRP approach is to retrain the purposeful activity again. Unlike traditional neuro approaches that focus mostly on muscle tone or reflexes. Let's take up this example of stroke patient gait training with MRP approach. Step 1 is analyzing the task. You have observed the circumductory gait pattern, and you know that this happens because of hip abductors and ankle dorsiflexors weakness. Next, step 2 is practicing the missing components. You train weakened hip muscles that are required for the normal gait pattern. You have designed some creative exercises to train these components, and patient practices these exercises. You have also used some visual, verbal, and sensory cues possible in these exercises. Now, the whole task is practiced by the patient after these exercises. So walking was the functional task. Patient practices walking and tries to integrate learning in this activity. Support and guidance with cues can be provided initially, and then patient practices the task by themselves on a daily basis for transference of learning. So that's MRP in action. We will be covering more detailed exercise protocols based on MRP concepts in our upcoming videos. You can use MRP in patients with stroke, hemiplegia, traumatic brain injury, cerebral palsy, etc. It works best when the goal is to restore specific lost functions, rather than just reduce tone or increase general strength. Next up in this series will be neuroplasticity and motor control in MRP. Don't miss it. Stay tuned. Thanks for watching.